So I'd like to welcome you back to our continuing education online training series for our Facebook, YouTube, and Advanced Horsemanship online users. Today we have the Ask the Vet any question you might have, and today's questions are going to be talking about vital signs. What the vital signs are, the abnormal, the normal, what you should be looking for, and so forth. So I'd like to welcome here my vet from Windsor Veterinary Service, Dr. Eric Wiles. Thank you for being on the show.
Nice seeing you again.
Dr. Wiles, I'd like you to explain to the crowd here today, I'd like you to explain what the vital signs are, the normal, the abnormal, and so forth. And let me ask you, if people were to call in to you, your normal clients, if they were to call in to you and they would ask you, or tell you how they have a problem with their horse, and they were to tell you these vital signs, would it be easier for you before you actually arrive on the scene what you could be dealing with?
It would be very helpful. It allows us a little bit of time to get some assessment as to what we're going to walk into. Considering a critical situation, some are more critical than others, and some need a little bit more planning. So knowing a little bit about what you're going to be confronted with is always helpful.
Good, good. Well, Dr. Wiles, why don't you go ahead and explain what some of the major signs are, or vital signs are, and I think we limited to about 7 different vital signs. Why don't you tell us what those 7 are and then go ahead and describe them in a little more detail.
The vital signs of the horse are a basic assessment that we use to check how the overall horse health is doing. We check the heart rate, the respiration rate, the pulse, the capillary refill time, the texture of the mucous membranes, the color of the mucous membranes, and the body temperature typically.
Okay, now not to interrupt you, but those 7 is what we limited it to for this video, but there's a lot more that you could go into.
Absolutely, absolutely. Depending on the situation that we're dealing with, there may be other organ systems that are involved, but these are the ones that are most critical for our knowledge in most circumstances.
Now, with those that you've already said, tell us what the normals are. Go ahead.
The normals of a horse, the heart rate usually runs between 32 and 52 beats per minute. And the heart rate is different than the pulse rate, as the heart rate dictates the actual beating of the heart, whereas the pulse is the flow of the blood through the circulatory system. Both the heart rate and the pulse should be equal at about 32 to approximately 52 beats per minute. The respiration rate should be somewhere between 12 and usually about 20 breaths per minute. It can go as high as 24, but certainly if it is much elevated above that, that would indicate a sign of stress. The capillary refill time is a process by which you look at the gums of the horse and you press above the tooth on the gum line, and by that causing the gum line to blanch, and then when you remove your thumb you count the amount of time it takes for the gums to actually turn back to a pink color. Okay. If it takes more than 3 seconds, then you could have a problem with the circulation of the horse or the horse being severely dehydrated. Likewise, we look at the color of the gums. The gums of the horse should be pink. In horses that are having a problem with getting enough oxygen, they may be a blue color, or if a horse is toxic, quote unquote, from having eaten too much of a bad substance, the gums may turn a muddy brown color. And then finally, we also look at the texture of the gums from the standpoint of they should be nice and moist and they shouldn't be dry and sticky. Lastly, we look at the temperature of the horse. The body temperature of the horse should be between 98.5 degrees Fahrenheit and 100.5 degrees Fahrenheit.
Okay, all right. Well, with all that being said, Dr. Wiles, why don't we go ahead and pull the horse out. We're actually going to pull my horse out, Jack, and we're going to go ahead and go through these again, show the people how to look for these vital signs, where to look for, and what to look for. Does that sound great?
Sounds great.
All right, well, let's go ahead and bring them out now. Well, now we're back now with our horse, Jack, and we're going to go ahead and go straight through all the vital signs, starting from front to back. So, Dr. Wiles, why don't you go ahead and take it away, showing us what we should be looking for.
Okay, the first and most important thing that we need to look at with the horse is the color of the mucous membranes, or the gums. And you can look here, and the gums are nice and pink on this horse. If the horse's gums seem to be discolored, if they are a yellowish color, which is normal in some horses because horses eat a lot of grass and vegetable substances, so they have a lot of keratin in their diet. The second place to assess the color of the gums, if you roll back the eyelid like so, you can see the color of the inside of his eyelid, and that should remain pink. Secondly, we want to look at the moisture level that the horse has. Some people often use the assessment of pinching on the skin over the neck to try to determine if the horse is dehydrated or not. Unfortunately, that is an unreliable source to figure hydration for an animal, as if a horse is overweight, the skin will tend to spring back very quickly, even if it is dehydrated, and if the horse is underweight, it will tend to tent. So the best assessment that you can do is actually if you lift the gums and then you feel them like so, and you feel your fingers. If they feel nice and wet, then the horse's hydration is adequate. If they're sticky or if they're dry, then the horse is somewhat dehydrated. The further dehydration that the horse shows, the more the eyes may show to be actually sunk into the skull. But we'll stick with the very simple, is his gums moist or dry? That generally helps for most people. The other test that we can do on the front of the horse is the capillary refill time. And if I hold his lip up, if he allows me to, I'm just going to gently hold his lip up, and we press right over the gum of his tooth, and we release. We count how many seconds it takes for the gum to turn back to a pink color. Normal is between 1 to 2 seconds. If it is over 3 seconds, then we would assume that the horse's circulation is not performing optimally. The next thing we're going to talk about is the pulse of the horse. The proper place to assess the pulse on the side of the horse's face is at the submandibular artery. Located on the bottom of the edge of this broad bone, the mandible of the horse, you'll feel a cord-like structure that feels kind of like a large piece of macaroni. If you gently press against that structure and hold your fingers there, you'll actually feel the pulsations of blood running through the artery. Each pulsation you would count individually as one, and the normal pulse of the horse should equal the heart rate of the horse. The other place that we can use, if we turn the horse slightly to the side, and I tend not to use this one as much simply because it's a little bit harder to assess, but there is an artery that runs down the inside of the leg, and you can feel at the base right here on the sesamoid bone on the inside, you can feel a cord-like structure there. And if you do the same thing, press very gently, you can assess the pulse there. Some people even come higher up into the middle of the cannon to do the same procedure. Again, my feeling is I do the best with the larger artery on the face.
Why don't you show us, our viewers that couldn't see it from behind, why don't you show us just where it would be on the front so they can...
This artery runs approximately in this region right here. And you can feel a little puffiness right where it is, and if you press and you hold and you concentrate, you may be able to feel that pulsation running through the artery.
But it is a little tougher to do it.
It is tougher to do it down there. I prefer using the method underneath the mandible. It tends to work the best. Okay, the next thing that we're going to talk about is the heart rate. Again, the normal heart rate for a horse is somewhere between 32 and 52 beats per minute. If a horse's heart rate under exercise may elevate above that. However, after 5 minutes, that heart rate should come back within the normal range. The bigger the horse, typically a draft horse, may have a lower heart rate, or even one with a really good amount of stamina built from years of endurance and exercise, may have a lower heart rate than one that is not in as good a shape. The place where you're going to listen for the heart rate is right behind the point of the elbow, which lies right here. Now we can do this in one of two methods. We can actually place our ear against the side of the horse, which is a little difficult with most horses, especially if they're uncomfortable. So you would actually have to get your head down into this position here and listen. The heart rate, as you can imagine, is a little bit slower than a person's heart rate, about half the normal rate. So you'll have to take some time in order to hear that. Typically, I tell my clientele to listen for the number of beats you count in 15 seconds and then multiply it by 4. The other way to assess it is to use a stethoscope. And a stethoscope is something that you can purchase at most farm stores or through a catalog. And the way to use a stethoscope, most importantly, is when you place it into your ears, is to take the bell of the stethoscope, which is this portion here, and tap it to make sure you can hear from it first. Then you want to hold it firmly against the side of the horse without moving it. Now, The heart rate of the horse should be audible in the normal horse, as I said, right behind the point of the elbow. If you have to, you may have to slide your bell of the stethoscope a little bit towards the elbow and off of the chest floor approximately 4 to 6 inches to get a good assessment of the heart rate. The respiratory rate of the horse can be assessed by watching the rise and the fall of the ribs. Every breath that the horse takes, the horse's ribs will expand and then they will drop. Count either the drop or the expansion of the rib. Each one expansion is one breath. If you count the expansion and the drop of the rib together, you will get a false assessment of the respiratory rate. Again, the normal respiratory rate lies in most horses somewhere between 12 and 20 breaths per minute. As high as 24 may be okay. And finally, we have the temperature of the horse, which we're going to take from the back end.
Now, let me interject, Dr. Wiles. I want to make sure that our viewers understand, like when you're taking the temperature from a horse that maybe you're not sure of or maybe is not too well trained, don't just get right behind the horse because let's say the horse doesn't realize it's coming and feels something cold sticking right up its rear end. Not going to be very comfortable for the horse. They may kick, they may run. You don't want to be in a dangerous position. So my recommendation when you're first doing this to your horse that you've never done this before, my recommendation is standing a little bit more off to the side, away from the horse from having the ability to cow kick you or kick you, or just staying out of danger's way when you're trying to do this. So this horse here, we've done it numerous times. He's actually fine with it, so we're going to move on. But I want you to understand, make sure to stay in a safe distance so that the first time you do it, so that way everything stays nice and safe, okay?
As I was saying, to take the temperature of the horse, we can use a couple of different thermometers. Certainly, over the counter, you can purchase a glass thermometer. Most people find that they're a little bit difficult to read. They do make thermometers for large animals. They're a little bit larger and stouter in size, so they don't break simply by if the horse shifts or moves a little bit. Some people use the ring portion of this to tie a string to and put a clothesline clip so that they can put the thermometer into the horse and clip the clothesline to the hair of the tail so that they don't lose the thermometer. Also, you can purchase from the drugstore a digital thermometer that's run by a battery and use that to take the temperature of a horse just as well.
Now, when you're using the glass thermometer, how long would you usually leave it in there for it to be able to take the temperature?
Typically, the tried and true suggestion is to leave the thermometer in place for about 2 minutes. And you have to be sure with a glass thermometer that you shake it down so that the mercury in the thermometer rolls down to the tip of the thermometer before you take the horse's temperature. Once we've shaken down the thermometer, we're going to take the tail of the horse and we're going to lift it, and we're going to be able to visualize the anus of the horse, and then very gently we're going to insert the tip of the thermometer and the thermometer itself approximately 2 inches into the horse's rectum, very gently in a straight line, following along the back line of the horse, horizontal to the ground. We're going to wait our 2 minutes, and once we've done that, we're going to remove our thermometer, and we're going to assess the horse's temperature. To assess the temperature with a glass thermometer, you have to hold the thermometer so that the triangular portion of the thermometer is pointing up towards the ceiling or towards the sky, and you will look so that the numbers are facing you. And when you look down upon that triangular portion of the thermometer and you rock the thermometer very slowly, then you'll assess the silver line that's present on the thermometer, and that will lay against the degree number on here that will tell you what your horse's temperature is.
Well, great. Well, Dr. Wiles, I'd like to thank you for being here. I hope our viewers learned something, because I know I sure did. And I'd like to welcome our viewers, our YouTube viewers, our Facebook viewers, and our Advanced Horsemanship online viewers to please write in for any other questions. We're going to kind of do a series, Ask the Vet. So if you guys have any questions, please feel free to ask us anything. We'll videotape it and answer it by putting it right online. So So guys, I'd like to thank you all very much for watching. Dr. Wiles, I'd like to thank you for being here.
Thank you.
Being a part of this, and we'll see you guys next time.